As a maxillofacial surgeon, we basically deal with all ailments that occur in the head and neck region. Now, some of them could be congenital, that is when a child is born, the child can be born with a cleft lip or a cleft palate, which is essentially a hole in the palate. And the problems then are primarily of feeding. Nursing the kid would be the initial problem. Of course, looks, when the parent sees the child having a split lip, they are quite horrified and would like to, some of them would like to abandon the child also because of psychological reasons. So repair of this cleft lip and repair of the cleft palate is done in different stages. They also can create growth problems of the upper jaw, which would have to be addressed at a much later stage. In some patients, it results in the nose being a little bit flat, so then it requires correction of the nose, which is essentially called rhinoplasty, which is also done by the maxillofacial surgeon. And it's a staged procedure, so at different stages the procedure is carried out. Also, counseling is given to the patient at regular intervals. There may be a speech therapist involved to help the child's speech and pronounce correctly, because the cleft in the palate can cause speech difficulties. The other things that we do are basically correction of skeletal deformities. Some people are born with upper jaw which is very short or small, and a lower jaw which is very protruded. For a balance of both cosmetics and function, we correct the upper and the lower jaw. We bring the upper jaw forward, or correct the position of the upper jaw, fix it with plates and screws, and it gives the patient or the person a very pleasing appearance. It also improves the function. Then, of course, trauma is a big challenge for us. With the increased road traffic accidents that one encounters every day, we see a lot of patients who have panfacial trauma of the face. People not wearing helmets and people not wearing seat belts can cause injury to their face, which can be both soft tissue as well as injury to the underlying bone. So correction of that, repairing, reducing it, and fixing this is another big part of our specialty. Then we also deal with oral cancer, patients who have habits of chewing pan, using the tobacco products which are available in packets. All this can lead to oral cancer, and it can be in different stages. And counseling them to stop their habits, as well as treating it surgically by removing it, operating it on it, excising it, and reconstructing it is a big part of our specialty.